Hello, everybody. We're halfway through the week. So, continuing the series on bleeding disorders, I'm actually going to answer some questions today about hemophilia. So, I had one question. What is hemophilia? So, hemophilia is an inherited disorder that results in spontaneous bleeding. So if you as a woman is not affected, and we'll talk about that in a little bit, it's manifested on because of a mutation on the X chromosome. So historically and typically males are more affected than females, where there are low levels of either factor 8 or factor 9. Worldwide, we see this disease in 1 in 5,000 males. So my next question I have is, how do I know if I or my baby is at risk? The family history is the big tell. So if you have available your family history, you will see where males might be affected, and then you have their daughters that may be carriers, so they might actually have mild disease. We'll go in that in a little bit. And then their daughters then have sons that are affected. And that's because it's X-linked. As you know, by genetic sex, XX are females. We have 2 X chromosomes, and XY are males. Males only have 1 X chromosome. So that is the big tell in the family history. And so if you see here, you have the mutation as represented by a dot. So a carrier female will have the affected X chromosome and a normal X chromosome. So when she's making her eggs, she will either donate the affected X or a normal X. When she mates with a male that does not have hemophilia, he will either give to his future offspring an X or a Y that would make the genetic sex. When they have offsprings, so these are the possibilities, they can either together from this combination can have a carrier female or a normal female. Now these carrier females, pay attention to that, because historically we used to think that they were unaffected, but they can actually have mild disease, and I'll talk about that in a little bit. So half of the females will be carrier, half will be normal. For the males, the affected X, if that's combined with a Y chromosome, this son will be affected. So as a baby, if they have a circumcision, they will bleed. They may be born with head bleeding in the brain, or if they have a circumcision, they will bleed. If they're walking, they may have muscle bleeds, and this will be the tell that there's a problem. Or they're normal. So half of the males from a carrier female will be affected. Okay, so can female be affected? Females, yes, can be affected. It is very, it's a low risk, but they can have mild disease or they may be asymptomatic. If one of the so a female can be affected if they inherited 2 affected X chromosomes, and they will have severe disease. If they only have 1 X chromosome, they can have mild disease, or they may have something that's closely related but not the same. If they have von Willebrand disease, we talked about that last week, as well as that X chromosome. I did a mention about the newborns. What are the symptoms? And we talked about either skin bleeds or circumcision. If they get their vaccines, they can have bleeding from that. What is the treatment? The treatment is a replacement of factor concentrates. that will need to be administered, and I would suggest that finding a treatment center that focuses exclusively on hemophilia. They're called hemophilic treatment centers. That would be a great place to get hooked up into, because all of the information, everything you would ever need about learning about it, helping your family understand it, treating, even teaching you as a mom how to inject the factor concentrate so you don't have to keep going to the treatment centers whenever there is a bleed. So that's all I have for you. This is Dr. Heather Stanley. Want you to breathe and walk good, and I'll talk to you soon. Bye-bye.